Welcome once again. Today we are going to see about the second part in hand instruments in operative dentistry. So basically there are various types of hand instruments and we saw that previously. This particular topic will include instruments which are used for examining. So for examination we use mirrors, explorers, periodontal probes and forceps. Instruments are used for cutting the tooth and removing the caries. For that we use excavators, chisels, hoe and hatchet. Instruments for placing and condensing the restoration material after you remove the caries, we use amalgam carriers and condensers. And after placing the amalgam inside the cavity, we use instruments which are used for carving and finishing. So for that, we use the carvers and burnishers. And other miscellaneous hand instruments include plastic instrument and cement spatula. So the plastic instrument is an instrument which is used to carry the cement in the plastic consistency, and that is why it is the plastic instrument. The other one is the cement spatula. Cement spatula are of two types. Either one which is a metal cement spatula which is used for mixing zinc oxide eugenol, zinc phosphate, zinc polycarboxylate, whereas the other one is the agate spatula. The agate spatula is a spatula which is used for mixing only the GIC. Why we use an agate spatula here is that we should not break the bonds during the mixing of GIC, which can be broken by a metal cement spatula. So that is why we use a agate spatula for GIC. So coming to the mirrors, mirrors are basically used for operating procedures so that we can have a clear and a distinct vision. So we use the mirrors in direct and indirect vision. So whenever indirect vision is useful, the mirror comes in hand. The basic functions of the mirrors are observation, reflection of operating light and reflection of tongue or buccal mucosa. So there are various types of mouth mirror. The regular mouth mirror and the front surface mouth mirror. The only difference between regular and front surface is that the silver coating is present on the inner side in a regular mouth mirror, whereas in the front surface the silver coating is applied on the outer surface of the glass, so it is more susceptible to scratching, but it gives a more clear image when compared to that of your regular mirror. And they are also available in various sizes and shapes as well. Then comes to explorer. The explorers are basically four types: the shepherd hook, the straight explorer, the cowhorn explorer and the Auburn's explorer. So these are used for identification of tooth lesion and to evaluate the margins of the restoration intraorally and the restoration based on tactile sensation. Coming to probes. Probes are of three types, that is straight probe, Brion's probe and periodontal probe. So these are used again for checking the margins and also examining the caries in the dentin during cavity preparation. The periodontal probe is basically more blunt and it has markings of 1, 2, 3, 4 is missing and also 6 is missing here. So these are used for evaluation the depth of the periodontal pockets as well as for the depth of your cavity preparation. Then coming to forceps. Forceps are basically used for taking the cotton and also used for hemostats or placing the articulating paper inside the oral cavity. It can also be used for carrying the cotton pellets or wafers. So coming to the instruments that are used for cutting teeth and removing caries. The first one comes as excavators. So excavators are used to remove the caries from the enamel and dentine and refining the internal part of the preparation. So the first excavator is going to be the hatchet excavator. Okay, it is basically a single bi-beveled instrument with a cutting edge of the blade in the direction parallel with the handle, and it is used in only push or pull vertical directions. Coming to hoe excavator. Hoe excavator is a single plane instrument. It has only a primary cutting edge which is perpendicular to the axis of the handle and distally beveled or mesially beveled. So this is used for preparing tooth preparation of the walls and forming a line angles. So these are most commonly used in a class 3 and a class 5 preparation for gold restoration only. Coming to spoon excavator. This excavator is the most commonly used during the dental practice. So it is basically a double plane instrument with right and left cutting movements and it is always made in pairs. Okay, so this is basically in a circumferential bevel and it is used for excavating the caries. You excavate the caries from the periphery to the center and not from the center to the periphery, because the amount of pressure exerted is much higher. So in order to avoid your exposure of the pulp, you start with the periphery and slowly remove it from the center. Then comes your discoid. Here it is nothing but the circular excavator which you saw. Here it is in the disc form, okay, but otherwise it is going to have the same purpose as that of your normal excavator. Then comes to your cleared excavator. So cleared excavator is nothing but it resembles a claw, and hence it's a cleared excavator, okay. Coming to chisel. Chisel is a primary instrument which is used for planing or cleaving the enamel or dentine. It cleaves or breaks the enamel and helps us to remove your caries from the tooth during the tooth preparation. Okay, so the cutting edge is only on one side and the bevel is at right angle to the shaft. So it is used in vertical, pull, push, right and left movement only. The other types of chisels includes the mono angle, bin angle and triple angle. It is nothing but the amount of angulations which are formed in the shank of the instrument. Then comes to the hoe. The hoe is again a form of a chisel in which the angle of the blade is greater than 12.5 centigrade. It is a single plane instrument and it has only pull motion. There is no, you cannot use it in pull, push and pull. It has only one cutting edge, so it is only a pull motion. Coming to the enamel hatchet. The enamel hatchet is yet again a most commonly used instrument. So the cutting edge of this enamel hatchet is parallel to the shaft. It is a paired instrument, okay. It has a shank which has more than one angle, and it is also used for cleaving the enamel and dentine from the proximal cavities or in the buccal and the lingual walls. So the potential cutting movements of enamel hatchet includes the vertical, the push, pull and either right or the left lateral cutting. Coming to gingival marginal trimmers. This is an important 5-mark question again, and it can also be a part of your 10-mark question. So gingival marginal trimmers are a modified hatchet. It is basically a pair of instruments, and each pair has a right and left beveled instrument, okay. So the uses of this gingival marginal trimmer is rounding or beveling of your interproximal line angles only. And so how to identify whether the instrument is right or left? It is basically, if the primary bevel is not visible, the instrument has a distal bevel. And if a primary bevel is seen and has a mesial or a reverse bevel, it is a mesial instrument. See, angle formers. Angle formers are modified chisel. So the basic cutting potential or the cutting movement is going to be vertical, push or pull. Then comes a special form of chisel which is known as Wildstein chisel. So Wildstein chisel has a straight vertical curvature in the shank and it has bevel only on one side. There is other types which is known as triangular chisel. As the name suggests, it is triangular in shape. Then comes a hoe chisel which is similar to that of an excavator but has a sturdier blade when compared to that of an excavator. Then comes the instruments which are used for placing or condensing the restorative material. So the number one is going to be the amalgam carriers. So these amalgam carriers are help in carrying the amalgam and placing it inside the cavity which we have prepared. So it has an hollow cylinder and based on the finger lever, it helps to carry the amalgam and place it in the preparation. Then once you place the amalgam, you have to condense, right? So we use condensers here. The condensers are used to compress the amalgam into the preparation, and it has a working end which has nips or maybe round with flat ends. So basically this working end are little bit serrated. So these serrations help the next set of amalgam which you are condensed to go and get interlocked, and there is not going to be any displacement of the amalgam. This also helps in better condensation so that the mercury is evenly spread. So the instruments which are used for carving and finishing the restorations, number one comes the carver. The carver are of various types such as Hollenbach carver, interproximal carver, number 14L carver and hollow or triangular blade carver. So each one has its own purpose of carving a particular spot. For example, Hollenbach is basically used for occlusal and proximal and even axial surfaces, whether the interproximal carvers are only used for carving the amalgam surface in the interproximal region. So these are the various types of carvers. Then comes to burnisher. Now that you have carved, now you have to burnish the amalgam. So burnishing the restoration is to smoothen and polish the surface. So you can also use these burnishers to shape the matrix band to achieve a proper contour during the restoration. And after the amalgam is carved, the burnisher may be used in a single rubbing motion so that there is a smooth surface. In case if you fail to do burnishing, the restoration is going to be a rough spot wherein more and more amount of plaque can accumulate, causing more secondary caries. So the other miscellaneous instruments which we saw was plastic instrument. As I told you, it is used to carry or place the material into the cavity which is prepared in a plastic consistency, and it is also a double-sided instrument. So one end has a nib, the other side has a condenser. Coming to cement spatula, so the cement spatula also comes in various sizes and it is used for mixing the cement for luting and restorative consistency.